Today is International Aniridia Day, and our final speaker today is actually going to help us celebrate the International Aniridia Day with providing news from outside the UK. In fact, we're going to go to central Russia, and we're going to hear from a doctor who has a brand new center that they want to tell us about. I'm going to introduce you to Dr. Natalia Sokonova.
Thank you. So I want to tell you about our Russian Aniridia Center, a specialized center for providing medical care to patients with aniridia has been opened on the basis of the Scientific Research Institute of Paediatrics and Children's Health at the Central Clinical Hospital of the Russian Academy of Science. Taking into account the specifics of the disease, the objectives of the center are clinical diagnosis, assessment of the severity of the conditions and determination of treatment tactics for patients with this pathology, determination of indications and surgical treatment, rehabilitation, prevention, formation of treatment standards and clinical recommendations, preparation of guidelines, providing expert support for doctors and administrators of the health system, insurance companies, patient associations, in order to ensure the continuity of the transfer of knowledge and practical skills in the field of Russian experience in the diagnosis and treatment of aniridia on the basis of the center. We form a team of experts, disseminate information among doctors and patients about the methods of diagnosis and treatment in this rare disease. The tasks of the center also include holding specialized conferences, lecturing, publishing in specialized publications, conducting training cycles for ophthalmologists, conducting educational schools for patients. An important aspect of the work of the center is the interaction with international centers of aniridia, participations in relevant international congresses and conferences, holding specialized international events in Russia, participation in the international clinical trials. So currently highly skilled specialists of various fields work at Aniridia Center. We use multidisciplinary approach, modern diagnostic equipment, and treatment methods that meet international standards, provide regular care to patients with congenital aniridia. Russian Aniridia Center has coordinator. Her name is Veronika. She helps patients make an appointment and accompanies each patient to the doctor. All patients diagnosed with aniridia undergo a full range of examinations by specialists, depending on the genetic analysis and the presence of the Vagrant syndrome. So our doctors are defectologist, functional diagnostic doctor, neuropsychologist, ENT specialist, neuropsychiatrist, endocrinologist, nephrologist, and orthopedics. So Dr. Bushueva Daria, defectologist, is a specialist who helps children with mental and physical disabilities to adapt in society. Dr. Valyalov Kirill, functional diagnostics doctor, he conducts a non-invasive study of internal organs and human tissues using ultrasound. Dr. Gogbirashvili Tinatin, the pediatric neuropsychologist, carries out activities aimed at the behavior and mental processes of the child and based on knowledge about the patterns of development and the characteristics of the functioning of the nervous system in childhood. Dr. Zelenkova Irina, ENT specialist, she studies and treats diseases of the ear, throat, nose, and nearby parts of the head and neck. Dr. Karkashadze Georgi is a psychoneurologist, a doctor who has universal knowledge in the field of psychology, neurology, and narcology, and treats functional disorders of the nervous system and phobias. Dr. Frolova Yelena, endocrinologist, she is a doctor involved in the diagnosis, treatment, and prevention of all diseases associated with the functioning of the endocrine system. Dr. Shukina Oksana on the photo, orthopedist, is a doctor who diagnoses and treats diseases and pathologies of the musculoskeletal system. So we work in the standard lifelong ophthalmological care of patients with aniridia who often need several surgical subspecialists to address their different complications such as glaucoma, cataract, and corneal scarring. Changing the subspecialists or remaining with just one specialist may promote a belated diagnosis of other complications. This might, as in belated diagnosis of glaucoma, lead to irreversible visual loss. In our opinion, one surviving low vision and pediatric ophthalmologist should guide any aniridia patient searching the best specialist for any complications arising and caring of the patient's post-operativity. So on this slide, you can see optical coherence tomography. This exam is performed for each patient who has indication. Each patient is photographed and stored in a database. Perimetry is performed from 4 years old to all patients. The following approaches might help to improve the lifelong care of aniridia patients and might benefit the aim of lessen the impact of complications in aniridia. Topical prophylaxis of aniridic corneal epitheliopathy from a very early age, regular measurements of intraocular pressure starting in young children, annual visual evoked pattern measurements, and routine visual field testing as soon as possible. Comprehensive optimization of surgical care independent of department location. While one experienced pediatric and low vision ophthalmologist should follow the patient continuously, thus monitoring the disease and stages of complications and advising the patient where to go for surgical treatment. This low vision ophthalmologist continuously follows the patient course, including adaptation of low vision aids according to the course of the disease, helping the patient concerning integration at school and at the place of work, and advising about social and legal compensation possibilities. In addition, the guiding ophthalmologist should inform patients with aniridia about possible systemic manifestations of X6 syndrome concerning metabolic and neurological implications, and should initiate appropriate investigations when applicable. So Russian Interregional Public Organization, Interregional Support Center for Patients with Aniridia Iris, provides great support and helps the center and patients in many matters. We are very grateful to President of the organization, Galina Gening. And we are very thankful to her. She and charity fund help patients for several years, and the patients receive glasses for free, eye care tonometers for home use. Charity funds also pay for consultations and all necessary examinations. We work closely with Laboratory of Genetic Epidemiology, Research Center for Medical Genetics, Russian Academy of Sciences, where patients undergo a genetic analysis. So welcome to the Russian Aniridia Center. We wish you all good health. Thank you for attention.
Thank you, Natella, for that presentation. Now is the opportunity, if you have any questions.
Yes, I see one question. How many patients with aniridia and with Buger syndrome have been seen by this center? So we have more than 150 patients with aniridia and 15 patients with the Buger syndrome.
Hi there. So with the patients that you've seen, my understanding is that the degree of visual impairment varies, I guess, quite a lot from quite extreme to very mild. Could you tell us a little bit on the mild side what are some of the most, I guess, the best case scenarios that you've seen with very mild impairment? And the reason I ask that is that we have a little one who has aniridia but doesn't seem to show much in the way of any visual impairment. So I'm just curious to try and get an understanding of whether there are other people in that category.
The call, unfortunately, has dropped out, so I do apologise for that.
Else would like to answer that question?
Yep.
Yes, please.
Go ahead, Galina.
Can I just answer the question? What this one family asked the question now. He said, like, there is some cases which is really complicated, and some cases it seems like can be easy. All this depending to genetic tests. This is why, like, all the time geneticists, they are doing this kind of analysis, the connecting between genetic test and appearing aniridia in life. So some cases with some kind of mutations, it's really looks like it will be easy. And some kids, we have like 2 kids who can see 80% and 70%, and they have the same type of mutations, and they don't have any complications. So this is kind of good job from our genetic institute. And our Aniridia Center, they are always looking at the genetic test, so then they can understand how the aniridia will appear in the life of patients and do some recommendation, consider their genetic test.
Thank you for that, Galina. That was, hope that's answered the question. Thank you very much. What I'd like to do at this stage is to thank all our speakers. I know some of them aren't present, but I'd like to thank everybody that has presented today for their time, and to you for joining us.